Hi, I'm Dr. David Geier, orthopedic surgeon and sports medicine specialist, and I provide commentary and education for athletes and active people about injuries, injury treatments, injury prevention in sports and exercise so that you can stay healthy and perform your best. One of the most common questions I get in my clinic, in my office, probably once or twice a day I get this question, is whether or not a patient needs x-rays or whether or not he or she can go straight to an MRI. Basically, the x-rays are likely to be normal, so they want to skip that and skip the cost and go straight to an MRI, which would potentially show the injury. So in this latest Ask Dr. Geier video, I want to read a question along those lines. Lori asks, I was recently hurt and I have no insurance and I need to pay for my own care. My knee's swollen and painful. It's difficult to bend and get in and out of the car. There's a crackling noise when I go up and down the stairs. Since I need to pay without insurance, would it be more beneficial to pay for an MRI or an x-ray? Will the MRI show the bone? I'm not sure if this is bone or cartilage. Okay, so that's a terrific question that Lori asks, and I think that this is an important discussion really for all patients. First of all, let's ignore the insurance or paying cash for just a second, because even though in this age of increasing insurance changes, people have larger deductibles, so this becomes more and more of an issue, but it really affects everybody. First of all, x-rays just show bones. They don't show tendons and ligaments and cartilage. Those, yes, would show up on an MRI, which shows bones like Lori asked, but it also shows soft tissue injuries, tendon, ligament, cartilage, muscle, things like that. But x-rays can show other problems based on changes that you see on x-ray. So you may see arthritis changes or breakdown of the cartilage lining on the ends of the bones because you see the joint space narrow and you see bone spurs at the ends of the joint, which show you more advanced arthritis changes. You can sometimes infer an ACL tear based on a small capsular fracture on the tibia that is pretty much consistent with an ACL tear. So a lot of times you avoid the need for an MRI. Plus, they show they show stress fractures, and a lot of injuries that make x-ray a good test. Most orthopedic surgeons don't skip x-rays. They go get the x-ray first and avoid getting the MRI first, which is a lot more expensive because a lot of times the history, basically what you complain of, the signs and symptoms of your injury, plus what an orthopedic surgeon like me finds on physical exam examining your knee, plus the x-rays, a lot of times we have a pretty good idea of what the diagnosis is, and then we can start treatments, physical therapy or rest, activity modification, or yes, order an MRI. Now the MRI is going to show you more definitive soft tissue structural damage like a meniscus tear, like an ACL tear or an MCL tear. And that can be very important, and we do that a lot of times even after the first visit. A specific traumatic event, say like an ACL tear, the patient lands awkwardly from a jump, hears a pop, the knee swells up real big, but you go to try to examine the knee and the patient's muscles guard so much, they tighten up so much, you can't get a good exam that shows you the ACL's torn, so you might get an MRI. The problem with going straight to an MRI is that one, a lot of times they're unnecessary, and two, they can complicate the decision making. For instance, you have maybe a 58-year-old tennis player or active runner that comes in with knee pain, doesn't remember a specific injury that initiates the symptoms, goes to a primary care doctor who automatically assumes, hey, this could be a meniscus tear, I'm going to skip the x-rays and get an MRI. But they come in to, say, my office for follow-up of the MRI with an MRI that shows a degenerative meniscus tear, but they also have changes consistent with arthritis. And it's hard to know if the arthritis is more the factor. If you had gone straight to the x-ray and you see bone-on-bone changes or even moderate degenerative osteoarthritis changes, you might have held off on the MRI right off the bat and institute treatments for the arthritis first and then maybe consider an MRI down the road. There's not a hard and fast rule about this, but again, most orthopedic surgeons try to get the x-ray first and save the $1,500 or $2,000 that an MRI costs. There was a study a few years ago that showed, and I don't remember the exact number, but it was something like 88% of MRIs ordered by primary care physicians in this one study where they were reviewed by orthopedic surgeons. About 88%, I think, was the number of those MRIs of the knee were felt to be unnecessary. So generally, if somebody has an acute knee injury, my recommendation and what most orthopedic surgeons would recommend, you go see somebody and get it evaluated before you get the test. Maybe even before you get the x-rays, go talk to a doctor about what happened in your injury, what kind of symptoms you're having. Let him or her examine you, and then get further advanced diagnostic studies if you need them. So I hope that was helpful. As always in these Ask Dr. Geier videos, this is not specific medical advice. It's meant for general information and education purposes. I haven't seen you or examined you, so if you have specific medical questions, please talk to your doctor. But I'd love to get more questions like this from you so we can answer them on future videos. Plus, if you like this video, I would love for you to subscribe to my video channel. I record videos like this once or twice a week, and you can subscribe and get them sent directly to you. I'd love it if you have people that have knee injuries or have a need for this type of information, share this video with them. Also, if you would like more resources on ways to stay healthy or perform your best, subscribe, go to my website, subscribe to my email list. It's completely free. You'll get resources that I only share about injuries, injury treatments, injury prevention. I only share by email, so sign up for that. And thank you so much for watching. Again, share your questions. I'd love to answer them on a future Ask Dr. Geier video, and I look forward to seeing you right here next time.